Hello, welcome. Today we have a guest who's coming to us all the way from Phoenix in Arizona. Erik Jensen has done several things before he took up his current profession, being a travel nurse. He has worked as a mascot, a camp counselor, managed shifts at Chick-fil-A, and then worked, I'm not sure I've got that pronunciation right, and then worked in events as an EMT. Having qualified in nursing, his strong work ethic and over 8 years of experience in healthcare, including pre hospital and emergency medical services, medical surgical, neurosurgical, and ICU step down units, all benefit from his skills. And another extremely important quality, the ability to be calm and capable in high stress environments. This is episode 96 of My First Job, the podcast that covers engaging career journeys. And every single one is full of twists, turns, and insights. I'm Venugopal Nair, the host of the podcast and CEO of Ideascape Communications, an advertising agency into branding, creative, and design. So settle in, sit back, and enjoy the conversation. Eric, welcome to the show and great to have you.
Thank you for having me. I appreciate it.
Okay, so you've done several things before you arrived at this current uh,
Yeah.
point in your career. So tell me what it was like in the first things that you did and how you got to where you are today.
Yeah. I should preface, I feel like I took the scenic route to get to where I am. It's been quite a journey. And when I look back, I find it very funny and also, I don't know, endearing that the things that past me had to do to get to where I am. So yeah, my first job, uh, which I love to recount, and I didn't think of it as my first job at the time. I kind of fell into it. My dad, it was spring break. I was 15, and my dad asked me to come with him to a conference he was going to in Kansas City, Kansas, and he invited me along, and it was a big expo for like a professional exposition, and I joined. And when we got there, he had a colleague who was needing someone to be a mascot for them.
Okay.
And offered me $200 to wear an Easter bunny costume, and and so
Okay.
I said yes because I was there all week and I had nothing else to do, and my dad would have
Okay.
been working. So for me to stay out of trouble and have something to do during the week, I agreed to wear an Easter bunny costume around the exposition floor. And my job was to advertise for my dad's colleague's costume company that he had,
Okay.
which was fun. And I guess I should include that the exposition was a theater company exposition. So it
Okay.
was for companies specializing in stage production and design. And
Okay.
so that's important because I wore this Easter bunny costume around. And at one point, they put me in a harness and they flew me over the exposition.
Whoa.
And I got to fly, as they call it in theater terms. And yeah, it was quite a funny. I don't know. I think it set the
Experience. Yeah.
stage for the rest of my career. That I just sometimes I don't expect
Yeah.
what's next. You can't expect what's next, and the fact that that's
Right.
my first job, I find very funny.
Okay. So what happened with the camp counselor bit? How did that happen?
Yeah. So when I wasn't working as a mascot, I that was my first job. It was a one-time thing. So my longer first other like official career was I had been going to camp since I was a young kid, and so it was kind of a natural transition to go from being a camper to wanting to work as a camp counselor. I think if you have that kind of energy, as I've been told, I have camp counselor energy.
Okay.
natural to then want to do that. And so starting around the same time as I was a mascot, after I retired from that career, I went ahead and in the summers I would go to a camp I grew up going to, and I grew up in Chicago, so I would go to Western Illinois, and I would worked at a camp there. And only looking back, I realized it was kind of a unique experience in that it would be all summer. So I would be gone for about 3 months at a time. The whole summer, from as soon as school got out in May, and then I'd be gone until September. And I did that for probably 3 years, 3 summers in a row.
So what is it like managing children? What is the camp counselor energy?
I think it's very upbeat. I think you're really excited about everything, and that kind of came naturally to me. I think you're trying to be over the top. If you've seen children's shows, you feel like those people on those shows are just like way overacting, but it's super exciting to kids. So like kids love it. And kids at a certain age are really easy to entertain. And then once they get older, it feels like you have to work really hard to to entertain them. And but if you have a certain like energy or enthusiasm or loudness, as I tend to also have a very loud voice, it's like managing kids is fun but stressful because they're just full of all emotions. And I look back and I realized that it was a really special time because I got to work with kids when they're discovering nature, they're discovering the outdoors, they're learning like about themselves and what they're capable of, because the camp was an adventure camp. So they were hiking and fishing and doing a lot of like outdoor stuff that I've really come to love. So not only was I getting to see kids do that, I was learning about myself, what I like, and it really shaped my appreciation for the outdoors and for nature. And
that's an amazing bit of understanding, because exactly like you said, you need to do certain things and get completely immersed in them to understand how you respond and react to each one of these situations.
That's very
So
true.
then the Chick-fil-A, is it? How do I pronounce that?
Yeah, so it's a Chick-fil-A.
Chick-fil-A. Okay.
Yeah.
Chick-fil-A. What happened? How did you get into that? And what is that? That was a kind of stopgap, or you decided that this is something that would be good to do? How did it work out?
So it's a really popular chicken sandwich shop chain in America. And I was in college, and I needed a job to help kind of pay for things. And I had some friends who were already working for Chick-fil-A, and I was living on the north side of Chicago, and there was one downtown Chicago. So it made sense. It was an easy enough commute. And so I applied, and I started, I worked my way up. I started literally cleaning tables, and that was like the first job they gave me before they trusted me to keep going. And after some life changes, I still work for Chick-fil-A. I ended up working for one out in the suburbs of Chicago. And it just so happened that my mascot experience came in hand because they had me, their mascot is a cow, because of course, like cows want you to eat chicken. So once I told them that I had experience as a mascot, they said, great. And they put me in the cow costume, and I was a mascot again for Chick-fil-A. And so it came full circle that they had heard about my expertise.
Okay. So life came a full circle within just a couple of years, or 2 or 3 years.
Yeah, it's just a funny insight that like the job that I took as a teenager, and then 4 or 5 years later, it happened to come up again. It was also a mascot, and and I was also managing. I was managing the shift, and I would I was in charge of people, and then every once in a while they'd be like, "Hey, would you like to go out on the floor and be the cow?" And so I said, of course. And I would take a break from managing for like 15 minutes and go walk around in a gigantic cow costume. It's
Okay.
just funny what all kind of like what experiences you never know what's going to actually serve you or I don't know, come
Absolutely.
up later.
Absolutely. So, where did the experience towards healthcare begin?
Yeah.
What
So
kind of
I'll,
experiences drove you towards that?
yeah. It's funny because when you lay out my career journey so far, it's maybe a little it's hard to see the tie into nursing.
Right.
But I think from a young age it started with just a very simple desire to help people. I think a lot of people in helping professions would agree that usually it starts with a feeling of wanting to help others. And I, as a kid, always wanted to be the one to help others. I always wanted to, put the band-aids on my parents' injuries and that kind of stuff. And so
Okay.
um, it was always in the back of my mind. And I took babysitting courses. I took first aid courses. And as but I didn't really pursue as many opportunities to be in healthcare as like a teenager or high schooler. And but I went to nursing school right out of high school, and
Okay.
for one reason or another, I didn't end up finishing nursing school right away. But I got enough experience to be what's like a nurse's assistant. So
Okay.
um, I think the tie-in just came from my own personal interest and desire to be a nurse. I think I settled on fairly quickly that wanting to help people and also doing something good with my life. I remember that being a big motivator and a big conviction of mine. And those two coming together, nursing seemed like a natural fit for those desires. And so I got my nursing assistant license, and when I then eventually moved back in with my parents, and the crossroads was Chick-fil-A or pursuing something closer to what I wanted to do, and ultimately ended up at a nursing facility as a nursing assistant as my first like healthcare job. And
Okay. So, what were the early jobs that you ended up doing while you were a nursing assistant?
yeah, so once I finally arrived, I actually I remember thinking like, okay, I've started, I've
Okay.
made it, and I'm finally in healthcare because I took a long journey to. At that point, it's not that long in hindsight, but when you're 20, and you've only been working 5 years, it's like God, it took forever to get here.
Very true.
But so my first job was as a nursing assistant at a it's called a skilled nursing facility in America. So they are kind of the bridge between like a long-term care, like a residency, and then like a rehab. So I worked at on a rehab floor, and I loved it. I immediately loved it. The patients and the people there. It was really interesting because they were fresh out of the hospital for some sort of injury that required rehab and more work. And so I started, and you start very humble. It's probably the hardest working and most humbling job I've ever done because you are really working hard. You're taking care of anywhere from like 12 to 15 patients at a time, and
Wow.
you're helping them constantly and with every activity of daily living. So basically anything that's not passing meds or things that a nurse could do, you're doing as the CNA. And
Okay.
it's hard, but very very rewarding. So.
Yes. And it's one of those jobs that will always be seen as essential, which is essential because
Mm-hmm.
I think when people go through a tough phase in their life, you are
Mm-hmm.
the person or your profession is the one that really gets them back into being normal or whatever we call normal today.
Yeah, yeah.
But
Mhm.
but in your mind, uh, do you find that this is hard? While you say yes, it is hard. But
Hmm.
the rewarding aspect is the ability to bring them back to a stage and then say that, okay,
Hmm.
life will go on. So, what
Yeah,
motivates you?
that's a good question. I think, yeah, I think you're exactly right. I think the motivation comes from the satisfaction of seeing people, like, in the best case scenario, people get better every day, and
Right.
people progressing. The most extreme example I can share is I had a patient who had a really like traumatic accident. She was walking on a path, and a tree branch fell on her, and she sustained like
Well,
multiple fractures. And by the time that she came to rehab, she had already been in the hospital for about a month recovering, and then they needed to get her to a place for more rehab and more rehabilitation. And she was at our facility for another 3 weeks. And when she came in, she was not walking. She was not able to take care of herself. And um, I got to see, like, from a firsthand account for how long she was there. By the time she left, she was walking. She was like dressing herself. She had really like come so far, and that's like a really like fairly obvious example or easy example to see, and an ideal example that, so, like, that's where I get motivation, is seeing patients like progress. And that's a really like idealistic example, and it's very cool to see. Not everyone is that just straightforward. So but
right.
that, when I think of motivation, I think of the patients that are day by day or slowly progressing towards a goal, which is usually to get home and find some sort of like, yeah, regular normal life again, or some sort of I guess like return to their functioning. And
Yeah.
that I just take a lot of pleasure in that, and a lot of pride in that, being just a very small part. Like, I might be the one who brought you water that day, but I
Right.
brought you water. And so I did my part, and like, and
Right.
that's nice knowing, and it's really rewarding to know that like you helped in any small way. It can be hard to remember that when the days are really hard and grinding, but holding on, I think, to a feeling of gratitude that you get to be a part of this, because it feels like, while not always the most, you're not always getting the recognition that you
Right.
feel like you'd want, but you're getting a sense of satisfaction that you helped, or that you like that you're able to contribute some way, in a way that's bigger than you, I think.
Yeah. And it's always going to be that way in terms of
Mm-hmm.
how people at a low point in their lives require this help
Mm-hmm.
because they are in a very difficult place mentally as well as physically, because it's not just the issue with their health, it's also their the condition that they are dealing with.
Mm-hmm.
But is there a huge difference between rehab and what happens in emergency rooms? Because I saw that you've also been a surgical nursing assistant. So, what are the challenges there? Is it about keeping calm? What happens?
Yeah. So definitely, the biggest difference is priority, for sure.
Yeah.
So, prioritizing in the most like blatant of terms, what is going to, I hope this is okay to say, like, what's going to kill you soonest, what's going to hurt or injure, or what's the priority to keeping you alive, basically. And
Yeah.
when they first come in an emergency situation, you're basically prioritizing, or you're triaging patients in terms of emergency and how critical they could be, and what's going to do the most damage first. And as you progress, once a patient becomes stable, that's where you progress into more like, then we're focusing more on like their activities, and finding some sort of function. That'd be the main difference between the two.
Okay. Okay.
But definitely in those situations, I think lots of people can do that. I think what's interesting or a quality that seems to come out is, as you mentioned, like staying calm or focused on like in a situation like that, because the last thing you want in an emergency is for your providers to also panic
Yeah.
or to
100%.
yeah
Yeah, 100%. That's really what the issue is. But
yeah.
is
Mhm.
that an internal trait, Eric? I'm trying to understand
Mhm.
what is the mental sort of conditioning of
Yeah.
someone who does this job well and
Mhm.
then finds satisfaction in it. Because
Yeah.
it's one thing to do it because people are compelled by circumstance. It's another thing
Mhm.
to do it because you really feel that you're making a difference and you can bring about that change. So
Yeah. I think the mental state is honestly a marriage of the two. In my
okay.
mind, in my mind, with staying calm and right, it is one. It's one thing to think like stay calm, and it's another to practice it.
Yeah.
And I honestly, the way that I logicked it out in my head was, well, to help someone best, you have to stay calm because you don't want that person panicking. And when they look at you in that moment, you want to give people a sense of confidence that
Yeah.
you want people um, to look at you or look at their providers or your team and think, oh, I'm going to be okay, or I'm in good hands, or this person seems like they know what they're doing. And so I think I'm internally motivated to help. I think that's all the first and foremost. And then I think I'm internally motivated to like show the person and reflect to the person that like I'm okay, like I am, like this is not surprising me or shocking me, and like this is not beyond my scope of practice is the phrase, like that this is something that I can handle, and if I can't handle it, I'm going to go find someone who can help, and find the next person.
Okay.
And I think that it is interesting. I don't want to say it's something that you have or don't have, because I think a lot of like healthcare needs all types and all people, but I think you fall into a mind state where the more you do it, the more comfortable you get too. So I've seen it tons and tons of times with new grads, when I was a new grad or when I was a CNA, or your first emergency, and you have that little bit of internal panic because you're seeing it for the first time, or you're seeing an emergency for the first time. So it's probably some sort of inherent state or like predilection towards being calm in emergencies. And also, the more you practice medicine, the better you get at it, and the better you become, where you can kind of identify the pathway that this person is on or what's happening, and you can quickly diagnose like what this is or what's going on and why. And then from all that practice, your calmness kind of starts to become more natural. You might already be a naturally calm person, but the more you can practice it, the more you can see it, and the more you can remember that like I'm here to help and want to contribute. That's where I think you can stay calm and focused in those situations better. So.
So what was your first emergency
Uh,
experience like when you started?
Yeah. So shortly after, I can remember shortly after my nursing facility, I spent 2 years there, and I went to a hospital floor. And so my next part of my journey was, okay, I moved into a hospital. I've made it. I've really, I always have that idea in my head. I've made it.
Right.
And now looking back, it's still part of the journey, but in my head, I'm like, oh, finally. And so I got to a floor that was a telemetry and observation floor. So patients were there, usually with like serious but relatively minor things where patients just needed to be held overnight to make sure that what brought them in isn't getting worse. So a lot of times it was like chest pain or minor injuries that rather than send you home from the emergency room, you just stay 1 or 2 nights. And so patients were relatively stable, and my first emergency that I can remember was it was a patient's room, and their partner was visiting, their husband was visiting, and I was going to help the partner out of the room, and he was at the end of the bed. And as I'm going to like help him into the wheelchair, because he couldn't walk really well on his own, he froze up, and I noticed all of a sudden he was like gripping the edge of the bed, and it turned out he had a seizure at the end of the bed, and I had to like lower him to the floor, and then I had to I'm almost embarrassed to admit at that point I had never had an emergency, so I didn't realize to just push the rapid response button in the room that would call help. So I lowered him to the ground and I said, "Stay here." And I ran out the room and I was like, "I need help." And I ran down to the nurse's station, and then like everyone came, and then I came back into the room and like I made sure he was okay. And we took him down to the emergency room to get him stabilized. But I immediately had that combination of, I knew to lower him to the ground and like stabilize him and make sure he was safe. But I beyond that, I didn't understand how to act yet. And I stayed calm enough to keep him safe. But if I maybe had a little bit more experience or like a coaching or if I were to do it again, like, oh, I don't need to leave the room. I can just like call for help.
Ask the, you know, I guess every single person who's learning, whether it's nursing or any of these situations, there is a process, but to adopt that process takes time. It's not something that comes simply out of being instructed to say, okay, when this happens, do this, because when you actually have to do it, it's a completely different ball game.
Absolutely.
So tell me, what happens in a hospital when let's say you're managing things, and how is it that team members slip into the roles that they've been assigned to manage a patient, because each one is performing a certain function?
Yes. So that's a good question. So for nursing specifically, there's all sorts of roles, and oftentimes it's what interests you, and quite frankly, it's oftentimes what jobs are available. So when I graduated nursing school, we all kind of apply to what interests you. And so within nursing, you might end up in the emergency department or on any number of medical surgical floors that are more generalized, or the intensive care unit. So in that sense, you kind of go where it's available, or where you have connections, or what interests you. In my case, I ended up on a neurosurgery floor that I applied to it as a medical surgical floor, and I had spent some time there already as a student and loved it. And then I actually fell in love with the surgical process. So in that sense, you kind of go what interests you. And then I think at least in healthcare, and I think this is true for a lot of professions, if not all professions, you can only be taught so much in school before you get into the job. And then you learn the rest on the job, and you become more specialized in the role. So you learn specifically how to do your job on a neurosurgery floor, an emergency department, and some stuff you learned in school doesn't always carry over to what you do as a professional. So that's kind of how it naturally falls. And then within your role, depending on what unit you're on, I think you kind of naturally learn what you're comfortable with. So you learn, and if in a healthy work environment, you can rely on people to help you. Nursing is often something quoted to me, or I'll quote to people, is nursing is a team sport. So you're there with your group and you're in charge of these people, but you have so much help. And I think one of the hardest things to keep in mind when you're in school is that I'm not doing this alone. um,
Right.
a lot of it is like to train you as if you're on your own, because that's how you can become competent, or they hope to make you competent in your skills and confident. But once you get to the floor, you have nurses who have worked there for 20 years, or lots of people to rely on. So you can kind of fall into your role. Like everyone, I always tell like new grads or other nurses, or I try to remember, like, you should always try to do things with your own confidence, as if like you can do it. And then remember to ask for help when you need it. So if it's IV starts, or any kind of procedure that maybe is not your specialty or you're very good at, that's where you can ask for help. And then you find the person who's really good at this but not good at this. Or I love wounds, so like I'll help with that, but I'm not good at IVs. So
Okay.
yeah.
Okay. So those kind of things happen. COVID
Mhm.
is one condition that tested hospitals and the healthcare industry. I mean,
Yes.
practically everything. It was one of the most difficult stages to get through. What
Hmm.
was your experience, or what is it that you saw during that time?
Yeah. Um, yeah, it's wild to think that we went through a pandemic and we're in a post-pandemic age. And of course, healthcare among numerous professions was greatly affected. Um, my experience was kind of interesting and unique. So I did get several years of healthcare before COVID. Um, so I did get a lot of time to see hospitals worked, how they worked in a like pandemic age, which I didn't work as a nurse before COVID. So I don't know what it's like to be a nurse before that, but I do know what it's like to be a nurse after COVID and slightly during. And I think what you saw was just like really difficult working conditions. Patients could be just so sick, and the scariest part, I think I remember, because I was brand new when the second wave of COVID hit the US. So I remember seeing it, and the scariest thing at that time was that patients could come in and they would just deteriorate and decompensate so quick, like within several hours. And you could go from needing a 1 to 2 liters of oxygen a minute to needing to be like on a like 15, 30 liters, like needed to be in the ICU on a ventilator, like within hours. And it would be, people could really crash, which was scary. And it's a lot of those factors of how quickly people could go downhill. And then at the time, we had medications to help people, but nowadays we have a medication called Paxlovid, which is the most like commonly prescribed pill for patients with COVID. But at that time, that wasn't really developed yet, or wasn't available. It's remarkable how quickly it became available, but at that time, it was other medications that were just kind of working. So the best you could do was to treat basically it's a viral infection. So we have very few antivirals. So you could treat other symptoms and other infections that might come with COVID. But the difficulty is trying to get people off of oxygen, keep people stable, and just kind of like watch them. And as time went on, it got more stable. A lot of patients with COVID would be like, they would just come in with an infection, but not need as much oxygen, and be like a lot more treatable as time went on. But the early days were, yeah, just really demanding, more so than just the healthcare profession like is typically demanding. But you have patients who were isolated for like weeks at a time, or like days and days at a time. And then just as a nurse, like you're going from, you might have 4 patients or 5 patients on a med surg floor, and most of them are COVID. So you're going from one room of like taking off all your gear and then putting it back on, and then taking it off, doing that ritual like 50 times a day. And then when you leave the room, if they need something or you forgot something, put it all back on and go right back in. And the mental, I think the mental toughness of that it required to be able to go to work every day, and every role was affected, right? Like the nursing, the assistants, the doctors, the respiratory therapists, everyone who wanted to like work with patients was affected when someone had COVID, and then of course the patients too. But like the whole team, it requires a lot more coordination, and so that toll, and then extrapolate that to like the entire healthcare system. So
Yeah. And the other part, which you mentioned right in the beginning, the ability to establish human contact, because you're wearing this costume and the
yeah,
patient doesn't see a person, they see this masked figure
yeah,
who comes
yeah,
towards them, who's helping them, and there's no way
right,
that you can actually go ahead with all the things that used to work earlier. You
yeah.
could put a hand on someone's shoulder, have something to say. Nothing of that.
Hmm.
I mean, maybe you would say it, but it may
Hmm.
not have sounded the same coming through the muffled masks and everything. That wow,
Yeah,
that is
and like, it's so
very
true.
difficult piece to get through.
Oh, absolutely. It's so true to make that connection. And then I think my heart goes out to those patients because, all of a sudden you have these like, masked and gowned folks coming in. So then in your mind too, I can only imagine you're like, what's wrong with me? Why, like, it's so scary that these people are all gowned up. Like I must be really sick or something must be wrong, like really wrong for this to be happening. And so then to try for the patient to connect with their staff and then staff connect with the patient. And some of the hardest was when you have patients who have like some memory issues or dementia, and then it's so hard to explain to somebody who's maybe used to living in a facility where they go to dinners with like all their people, right? They eat in like a dining room with or they have a community, and then to try and explain to someone who can't really be explained to, like, hey, you need to stay in this room and be isolated, and you can't leave your room, and oftentimes you're so sick we can't really let you out of bed, like, that's so you can't really explain it. And a lot of times, a lot of patients or nurses I know and a lot of assistants I know and myself, like, if you could spare, like one of the things we would do is just like sit in there with your patients. Like you would be all gowned up, and no one wants to sit in gowns and masks, but we kind of encourage the other nurses, like if you could just like spend time with your patient, because they are like, it's really scary. And they don't get to see anybody. And at the early days, we also, at least my hospital, we didn't let visitors. So they couldn't even like visit with like their family or anybody. They could talk on the phone or video call, but patients were like truly isolated. And then eventually we would let like one or two family members at a time in to visit. But these people, like the only people they would have a lot of the time was the nurses or the staff to like actually visit with. And it just kind of broke my heart, because a lot of times those patients who are confused, they just want someone to talk to, or they just want, like, they're so used to their routine of, leaving their room and going to be social. So that was really
Yeah.
difficult.
And I think it really proved the fact that, technology can do a lot in terms of taming the disease, providing a vaccine,
Oh yeah.
uh, a cure is available. But the human connection, I don't think can be virtual. It's
Yeah.
it,
Mm-hmm.
it still has to be face to face. It still has to be the conversation. It could be a simple conversation, like you said. But
Mm-hmm.
at the end of the day, that makes a huge difference to how people feel about their day and about themselves,
Definitely.
which is what you do. You meet with people at their lowest,
Yeah.
mentally, physically,
Mm-hmm.
and you're telling them just hang in there and things will get better.
Yeah. Yeah. And
And
and oh, that's so true. Yeah.
yeah,
It's
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 a
hard to replace the human connection element. It really
Yeah,
is. And most people, you find that they just want to share their stories. They just want to like
absolutely.
for you to, and they want you to know something beyond what their name and date of birth is. you
Wow,
know,
it's a lovely
they
way to say it. Yeah, it's a
they want
marvelous
to.
way to state it. Okay, so
No, go
let's
ahead.
get to. I mean, I know that this can. It'll definitely be emotionally a lot more draining. So, what have you found has kept you in the profession? You
Mm,
started out with certain expectations of helping people, but
hmm
having spent years now, what is
hmm
it that you find is most fulfilling?
Yeah, that's a good question. Yeah, I think I went through this early on. So I worked as an assistant, as you know, and then I became a nurse. And the short answer is you have to keep finding your own source of joy. So what keeps you motivated, what's gonna make you happy is you have to ask yourself, and only you can answer for yourself, of like what is going to be my source of joy and happiness in this job, and what's going to keep me motivated. For me, it's still a desire to help, and then I've added it over the years. Like I've discovered about myself, I like to learn. I love to learn. I love to continue on this profession, and that keeps me engaged and invested. Is learning more and more about like these disease processes and these patients, and getting a deeper understanding of like of what is going on beyond the interpersonal level. So that's kept me engaged and finding opportunities to advance my career. There's lots of opportunities for nurses, but I think just learning more about it, so and finding new roles that I can go beyond just working with patients at the bedside, that's kept me like motivated and invested. Um, and
Okay.
yeah, the long answer is I think you have to find your own sense of joy, because it has been years that I've worked in this job, and something I've learned is this job, like a lot of jobs, like any job, will continue to ask more of you. It always needs more as you go along, and will require and ask. Like a lot of places just need the help and need the staff, and want the staff. And if you don't set up your own boundaries or your own like set of ideas for like how you want to live your life, your work can really take over, especially in a helping profession where there's always a need. And you have to have a healthy like work life boundary. And I think a lot of young nurses, including myself, you feel guilt. Like you feel a sense of guilt when you're not helping or you're not there. Like, oh, I have to go home now. Like I have to go do something else, or and to trust that someone else can take over is really hard. It's and So when you have that feeling, that's where you can get into trouble, because then you just continue to give more and more of yourself, and that's where you get burned out, or you get tired and feel slightly like taken advantage of. Is if you don't set up your own boundaries, you'll feel kind of you'll feel kind of burned out. So when you
Yeah.
get that burnout, that's where you have to remind yourself of like, yeah, why did I get in this in the first place? What is my own source of joy? Because the job, while providing joyous moments, I think sometimes if you depend on your job to bring you joy, you might also get burned out because the job can't give you that all the time.
Right.
There's going to be really difficult parts. So what is my joy, and what do I bring, and how can I get that beyond my workplace? And all that keeps me pretty
That's
mentally level.
great. And this is for sure, this is one job that AI will never replace. I mean, you can do all,
Yeah, that's a good
you
point.
can say all you want about the wonders of AI and where it comes in, but the pure on the ground jobs, there are a whole lot of them which involve
Mhm.
people working with people. And that
Yeah.
is never going to change, because you can probably change some of the modes of treatment, but at the end of the day,
Mhm.
this still makes a huge difference in how. Um, so, the more basic questions, Eric, which is What are the compensation? How is it that the job, where does it start off? What kind of salaries do people end up getting initially, and what can they aspire to, and should they look for?
Yeah. So these in America, it is dependent a lot on your state for compensation. You can kind of look at if you go and search for compensation rates by state, different states will have better rates, different cities. Generally speaking, cities will have higher compensation, not always, just depending on population and business. Who you work for will also factor into that. In America, there's healthcare systems. So like Advent Health is a big one, or other like systems that are nationwide, and they also kind of set the benchmark for pay rates and compensation, and it's gotten better even in the last 10 years. So from personal experience, so I was working, my first nursing job as a nurse was working in Denver, Colorado, and I started at $30 an hour. And then from there, slowly worked my way up to, I think my first raise was 25 cents. And then I kept going and building. And eventually I think I left that job after 2 years at 37. So fairly good increase. And at the time, $30 an hour was pretty good, was considered for a new
Right.
grad. That was a good compensation. And that in Colorado is pretty well paying, considered to be. And then I worked in Oregon recently at a small town, and their starting rate for nurses is 42 an hour. So, and that has to do with they are really well represented. They have a strong nursing union, and they've done a lot of negotiation with hospitals and the state to make sure that their nurses are really well paid and well compensated.
Okay.
Yeah, so that's that part of it. And then as far as like aspirations go, so you enter the workforce as a nurse, typically with your registered nurse degree. So that's a 2-year degree in America, and then you get your bachelor's degree. So if you go to a 4-year university, or you go to a 2-year school and then a 1-year bachelor's degree. And then most frequently, hospitals and states want at minimum your registered nurse, so your RN. And then a lot of hospitals want your bachelor's degree, and that's for certification and their credentialing for the hospital. But from there, nursing's incredible. You can do just about anything in nursing. If there's a work role that needs at all like a healthcare mind, you can be a nurse in it. You can do nursing informatics where it's technology, and you work in an office with charting systems. You can be in a surgical, you can work in an OR and help a doctor and a surgeon. You can work at a pediatric office with an outpatient with a primary care doctor. There's all sorts of roles, and you can be a case manager that does like specifically helps with that. You can work your way up into management where you're managing other nurses, and it just kind of depends on what you want to do, which is pretty amazing. It can be a little daunting because there's so many opportunities, there's so much to do, and it's it also depends on like who you know and who you go, when you go to school, like where you're doing clinical, what connections your school has, what jobs you get, who you meet. That can also help, like, hey, I have someone that works in the ICU, would you be interested in applying, and kind of going from there. So
How did you settle on what you currently do, which is being a travel nurse? What exactly, if you could help people understand how the job works, what happens, and how you came up to it?
Yeah. So travel nursing specifically is a nurse who typically works for a staffing company, and hospitals will put out their needs for staff that maybe they can't hire as a full-time staff. So at the time, or not soon enough. So to fill their gap between what they need and what they have, they hire temporary workers who are travel nurses. So travel nurses give up the stability of a staff job and like the security of that for more flexibility. So it's a trade-off where you get to travel to fun places and cities and
Right.
areas around the country, and you get for that they pay you better. So definitely companies compensate you usually better. I heard that during the pandemic the pay was a lot better than it is now, but it's typically better than working as a staff job. And then as a trade-off, you are asked to be a lot more flexible. So you might have places that compensate or give you a full shift. So three 12-hour shifts is typical. So guarantee your hours, and then some that don't, or some that have a policy for how often you can be canceled, that kind of thing.
Okay.
But as a travel nurse, you are going wherever there's a need. So you can look at a list of contracts, and you might be whatever you're qualified for. So a medical surgical nurse, that's my expertise. And there could be one in Los Angeles, California. So they're paying this much. It's for this long. So typically 13 weeks is the length of contract. That's pretty standard. And you have a start date and an end date. And a lot of companies will compensate you for housing and for your stipend for like meals and groceries. At least how my company does it, it's kind of interesting. The hourly rate, my compensation rate is actually less than I made as a staff nurse. But what
Okay.
makes me get paid more is the stipends. So my housing stipend, my grocery stipend, all that makes up for more. So it comes out where I'm getting compensated fairly well with that. And then what drew me to it was just the ability to do something different. And at the time we were living in Denver, and it just was so exciting. The idea of like, oh, we could go anywhere in the US. Like I could work anywhere, and it's a little daunting to go to a new hospital and meet new people. And it's a pretty short acclimation period. But we went from Denver to a tiny town on the southwest coast of Oregon, and loved it. I absolutely loved it. And there's just the adventure of it. I think I've come to learn that for travel nursing, I think like the compensation is great. I think you really have to be very flexible and ask yourself, like, how flexible am I willing to be? Because all of a sudden you're very much like just like a plug and play kind of person for the hospital. So you might be on the unit that they tell you you're going to be on, or they say, actually, we're going to float you somewhere else. Or like you have to be very flexible and be willing to be uncomfortable. I think that's it's going to probably, I don't know. I know people who are really comfortable and like probably more calm and chill than I am as a nurse, who can deal with that a little bit easier than I do. But it is a little jarring, where it's not exactly as going to plan. It's different than what you expected.
Right.
To be
But it
flexible.
allows you the flexibility of going on treks which you love, and
Yes.
allowing you to see places which you may not have visited if it was not for this particular
Yes.
assignment.
Mm-hmm. Exactly.
Okay. So, one of the things that I suppose you would continually get better at is assessing the environment within a hospital and understanding patients the moment they come in. That
Mm-hmm.
is, when a patient comes, do you think your ability to read what they require has improved over time?
Yes. Definitely. I think I call it like a pathway, a route where someone comes into the hospital and they're coming in with whatever is bothering them, whatever the problem is. and they are already on like a pathway, but they're also at the starting line, I guess, if I'm to use that metaphor.
Right.
So from there, it's kind of by the time they come to medical surgical, like an inpatient floor, they are already pretty well established for what the main problem is, the chief complaint is. But that could also change. I've learned that they, for what they said they came in for, could be completely different. Like, and they find something else. And it's only been like over time and just, I mean, you work with a minimum of 4 patients a day, 3 times a week. You see hundreds, if not thousands, of patients later. From when I first started, I hope and I think that after thousands of patients later, that you recognize a pattern or a pathway, or they said they came in for this, but it's evolved to this. Okay, that means they're probably going to need this, this, and this. Like you can start to identify, and I think one of the biggest traits and like one of the best things that nurses can start to learn, and anyone in healthcare, is like a sense of anticipation, where you're not necessarily always jumping ahead, but you're anticipating, okay, they have abdominal pain. We drew their labs. This is what their lab work looks like. This lab work tells me it's probably their gallbladder. Okay, they might need their gallbladder out. And you can kind of like piece it together that way. And that gets better over time, where like it's almost like a language or deciphering, like this thing means this.
Okay.
And that
Okay.
that keeps me very engaged. I love that. I love the
Okay.
deciphering and the anticipation and the planning and the pathway that patients go on. It's very exciting. It's almost like figuring out a puzzle, and you're given
Right.
like these are the things. Now what?
Right. Right.
So
Terrific. Thank you, Eric. This has
yeah.
been a marvelous conversation because I got to know so much more about what goes on in the mind of a person who's interested in caring for other people. And while all of us profess to say that we'd like to help others, you're the
Mhm.
ones who are doing it.
Oh, thank you. Thank you.
I
I
mean,
appreciate
it could be that people are helping in various ways, but at a point when they're low, at a point when they really need help, you're the people who are there, and you
it.
represent a community that is
Mhm.
essential for people anywhere in the world, and
Mhm.
bringing them back. So, thank you for what you do. And if you have any closing remarks, then
Yeah. No, thank you so much for having me and giving me the opportunity to speak and share, and hopefully share something that's helpful for those out there that are interested in healthcare nursing. I think I really want to encourage anyone out there to try it, see what they like, and start. My best piece of advice is start small. I think starting as an assistant, starting taking classes, doing anything that gets you a taste of it and gets you some experience, and going from there. And I think like the world needs nurses, the world needs every one of these roles. So for anyone out there interested at all, it's a challenging but rewarding career, and I encourage everyone who's interested to give it a try and see if it might be for you, and find your place, because there's lots and lots of roles in it. So
great. Eric Jensen, thank you for coming on the show.
thank you very much.
That was Eric Jensen, and he spoke with great charm and understanding of what it means to provide care on a day to day basis when people are at their lowest. Next week, we'll be back with another guest and another profession. Until then, keep watching.